Pulse rate. The pulse rate, often used interchangeably with heart rate, is a vital sign that provides crucial information about a person's cardiovascular health. Definition of pulse rate. The pulse rate is a measurement of the heart rate, specifically the number of times the heart beats per minute, BPM. It is the wave of blood in the artery created by the contraction of the left ventricle during a cardiac cycle. As the heart pushes blood through the arteries, these vessels expand and contract, and this can be felt as a pulse at various points on the body where an artery lies close to the surface of the skin and can be compressed against a bone. The strength or amplitude of the pulse reflects the amount of blood ejected with each myocardial contraction, stroke volume. Methods of measurement. The pulse rate can be measured manually or using electronic devices. 1. Manual palpation. This is the most common method and involves using your fingertips to feel the pulse. A. Technique. Use the tips of your index and middle fingers. Avoid using your thumb as it has its own pulse. B. Gently but firmly press on an artery until you feel a pulse. C. Count the number of beats for a specific duration, typically 15, 30, or 60 seconds. D. If counting for 15 seconds, multiply the count by 4. If counting for 30 seconds, multiply by 2. For irregular rhythms, it is best to count for a full 60 seconds. E. It's generally recommended to take the pulse at the same time each day, ideally when at rest and in a comfortable position for at least 5 minutes. 2. Auscultation, apical pulse. This method involves listening directly to the heart sounds using a stethoscope. A. Technique. Place the diaphragm of a stethoscope over the apex of the heart, usually at the fifth intercostal space, mid-clavicular line, on the left side of the chest. B. Count the heartbeats for a full minute. C. This method is particularly useful for infants, children, and individuals with irregular heart rhythms where peripheral pulses might be difficult to feel or unreliable. 3. Electronic devices. Many modern devices can automatically measure pulse rate. Fitness trackers, smartwatches. These devices use optical sensors, photoplethysmography, to detect changes in blood volume under the skin and estimate heart rate. Pulse oximeters. These devices are typically clipped onto a finger and measure both oxygen saturation and pulse rate. Blood pressure monitors. Many automatic blood pressure monitors also display the pulse rate little bit of body text. Sites of taking pulse. The pulse can be felt at various points on the body where an artery is superficial and can be compressed against a bone. Radial artery, wrist, most commonly used. Located on the thumb side of the wrist, between the bone and the tendon. Carotid artery, neck, located on either side of the neck, next to the windpipe, in the groove under the jawline. Caution: do not press on both carotid arteries simultaneously, as this can restrict blood flow to the brain and cause fainting. Also, avoid pressing too hard. Brachial artery, inner elbow, found on the inner side of the upper arm, in the groove between the biceps and triceps muscles. Often used for blood pressure measurement, especially in infants. Femoral artery, groin, located in the crease at the top of the thigh, near the groin. Assessed in emergencies or to check circulation in the lower limb. Popliteal artery, behind the knee, deep within the popliteal fossa, behind the knee. Assessed with the knee slightly flexed, mainly for evaluating peripheral arterial disease. Dorsalis pedis artery, top of foot, on the top of the foot, lateral to the extensor hallucis longus tendon. Used to assess circulation in the foot. Posterior tibial artery, ankle, located on the inner side of the ankle, just behind the medial malleolus, bony prominence. Also used to assess peripheral circulation in the lower leg and foot. Temporal artery, temple, in front of the ear, on the temple area. Can be useful in specific clinical scenarios, such as evaluating cerebral blood flow or in conditions like temporal arteritis. Apical pulse, apex of the heart, directly over the heart, typically at the fifth intercostal space, midclavicular line. Measured with a stethoscope. Clinical interpretations. The pulse rate, along with its rhythm and strength, provides valuable diagnostic information. 1. Pulse rate, beats per minute, BPM, normal resting pulse rate. Adults, 60 to 100 BPM. Well-conditioned athletes can be as low as 40 to 60 bpm due to improved cardiovascular efficiency. Children and infants have higher normal resting heart rates, e.g., newborns, 100–205 bpm, toddlers, 98 to 140 bpm. Tachycardia, a resting pulse rate consistently above 100 bpm. Causes: exercise, stress, anxiety, fever, dehydration, pain, infection, certain medications, e.g., decongestants, asthma medications, hyperthyroidism, anemia, heart conditions, e.g., arrhythmias like atrial fibrillation, ventricular tachycardia, stimulants, caffeine, nicotine. Bradycardia, a resting pulse rate consistently below 60 bpm, unless a trained athlete. Causes: high fitness level, certain medications, e.g., beta blockers, digoxin, hypothyroidism, heart block, sick sinus syndrome. If associated with symptoms like dizziness, fainting, or fatigue, it can indicate a problem. 2. Pulse rhythm. Regular. Beats occur at consistent intervals. Irregular. Beats occur at inconsistent intervals. Regularly irregular. Irregularity follows a pattern, e.g., a skipped beat every few beats. Irregularly irregular. No discernible pattern to the irregularity, e.g., atrial fibrillation. Irregular rhythms can indicate cardiac arrhythmias and require further investigation. 3. Pulse strength, amplitude. Strong, bounding. A full, easily palpable pulse often indicates increased stroke volume or elevated blood pressure. Normal, easily palpable but not overly strong. Weak, thready. A faint, difficult to palpate pulse often indicates decreased stroke volume, hypovolemia, low blood volume, or shock. Absent, no pulse detected, indicating severe circulatory compromise or arterial occlusion. Factors influencing pulse rate. Age. Pulse rate generally decreases with age. Sex. Females typically have slightly faster heart rates than males. Fitness level. Physically fit individuals usually have lower resting heart rates. Emotions, stress, can temporarily increase pulse rate. Medications. Many medications can affect heart rate, e.g., beta blockers slow it, stimulants increase it. Body position can cause slight variations. Temperature. Fever increases pulse rate, hypothermia decreases it. Body size. People with obesity may have a slightly higher heart rate. Underlying medical conditions. Various conditions, as mentioned above, can significantly impact pulse rate. Thank you.